Hello, we're going to talk today about documenting wounds for successful reimbursement. So this is going to be sort of a lengthy presentation. It's going to be about an hour and a half longer. I'm going to try my best to make it an hour and a half long. So some of these slides we're actually going to be flying through because it talks a lot about the anatomy and the physiology of the skin. So it's more of a reading type of a thing, but I want to get into the meat and potatoes of actual documenting your wounds. So, of course, we have the learning objectives. You should be able, of course, to explain the phases of wound healing because that's really important in understanding those phases in order to begin to heal a wound. We're going to talk about pressure ulcers. We're going to talk about options for pressure ulcers, lower extremity ulcers, and, of course, documentation and treatment guidances as it relates to Medicare. So, just to let you know, we've got some really gross pictures. So this is just a woo. If you have a weak stomach, I'm letting you know ahead of time. I'm all about some really good pictures. So first we're going to talk about the wound healing phases, and this is the part that I'm going to briefly just talk about. But it is an area that you actually really need to know a good bit about. This talks about the tissue repair phases and their time scale. And at the bottom you'll have the hours, days, weeks, and months. And you'll see, of course, the bleeding phase of it, or the hemostasis phase of it is actually the shortest portion of it, with the remodeling portion of it being one of the longer, the proliferation and the remodeling. So just to kind of give you a little bit of an idea. So the phases, the hemostasis, inflammation, the proliferation, and the maturation. So that's what we're going to be talking about over these next couple of slides. So let's talk about hemostasis. Of course, hemostasis occurs, you've got a wound, the wound fills up with blood, and what that causes is a cascade of events. It lets the body know, that bleeding and stuff lets the body know that, hey, look, I've had an injury, okay, so I've injured the blood vessels. They've released the fibrogen, and the fibrogen is what causes the clot formation. That causes the bleeding to cease, of course, because of the clot formation, and then that's what begins the mechanism of the healing process, okay? So this kind of gives you an idea of what it looks like. So the wound is actually filled with the blood and the blood clots, and that sort of kick-starts the body into saying, look, I have a new wound, I need more nutrients, I need more good cells, white blood cells, red blood cells, in order to bring a lot of nutrients and oxygen to this wound to begin that wound healing process. So let's talk about the inflammation stage. Of course, the inflammatory stage, the blood vessels, they become very permeable and they dilate. Okay, so those growth factors, they release more platelets, and this causes this to occur. Then, of course, the white blood cells, they come in and they destroy all of that bacteria, and they clean or sort of cleanse the debris out of the wound. So that's why a lot of people during the inflammatory stage, you'll actually see the reddened area around the wound, because that's all of those blood cells blood vessels that are actually dilated and is causing that red coloration. Now, a lot of times patients complain of a lot more pain during this particular phase of healing, and that's a normal occurrence. But that doesn't necessarily mean that there's an infection going on. We need this particular stage in order to get to that healing portion. And this kind of gives you an idea of a picture of the macrophage and the fibroblast, the migratory epithelial cells, the granulation tissue starts forming. So this kind of gives you a visual of kind of what's going on during this inflammatory stage. Then we have the proliferation. Now, y'all, this can occur typically approximately between 3 to 6 days after the wound occurrence. But it can last a number of weeks if the wound continues to stay open. The proliferation, that granulation tissue actually starts to form, the granulation tissue. Just to give you an idea of what granulation tissue looks like, it's red, it's very, I call it like red cauliflower. Nobody's going to think of cauliflower in the same view, but that's exactly what it looks like when you're looking inside the wound. It's very like bubbles, big lumps of bubbles that are inside that wound, and that's good. That means that my wound is beginning to heal. It is getting enough nutrients, it's getting enough oxygen to it to begin that proliferation. So during this phase, the risk of dehiscence increases. Now, of course, dehiscence there again is where the wound opens up more. Because of those new tissues, they're extremely fragile. And the wound also develops a new blood supply that provides those nutrients to heal that particular wound. And that's also epithelialization occurs during the proliferative phase. Now, one thing I want to remind you, and I think we're going to go over it again a little bit later on in this presentation, is that granulation tissue and epithelialization is very different, okay? Especially when we get into some of the OASIS items when it talks about the wound healing and the stages of wounds. You're going to have to know the difference between granulation tissue. Granulation tissue has to have depth, okay? Because when a wound has depth, it fills up from the base of the wound all the way up to the surface of the wound where the wound edges are. Once that granulation tissue fills up to the edges of the wound or the top of that wound, then epithelialization occurs across the wound, okay? So that's why we say that